this video, I'm going to be discussing one of the most common questions we get about ASEA, which is how much of this do I actually need to drink? And what I want to share with you is that, first of all, ASEA is not a medication. So there's really no dosage, no prescribed dosage. We talk about it really in serving sizes. And understand this, ASEA is 100% non-toxic. There is no lethal dose. So they did a study, most drugs, right? They have an LD50, a lethal dose that will kill 50% of the lab rats that they give it to. And then they titrate it down to be an acceptable amount for the human population. I couldn't find one with ASEA. I think the only way that you can have a problem with this is if one of the animals drowned in it. It's something that creates no toxicity in the body. It's not processed, through the liver or the kidneys. It's not something that can build up in the system. Your body just uses it and then reverts it into saline. There's no contraindications. I think this is important to understand because if you're currently taking medications or you're on a certain regimen, you're taking certain supplements, adding this is not going to impact them. There can be no contraindication. What we do see is that it can amplify the impact of what you're currently doing, which is wonderful. Now, studies show us that 100% of the time, this makes an impact in 100% of the people or animals being tested. So it is working. It is impossible for it not to work in your body. Every single cell communicates with redox signaling. And so when this goes into your system, it will start working for you, communicating where your body needs it. It's just sometimes we're not consciously aware of what's off in our body. And when we drink this, our body determines where it goes. All right. We might consciously think, well, I want it to go to my shoulder. I want it to go to my digestive system or whatever it might be. But the body knows what it really needs and it will go there first. And the body kind of has its own checklist. All right. So what I want to share with you is just how you can set yourself up well, expectation wise, so that you can feel what's happening on the cellular level, on the system level, all right, and to know how much do I really need to take. First of all, baseline yourself. All right, we have a baseline health tracker. Reach out to me in the comments if you don't have it. We'll make sure you get it for you. One comes in your box. We have a more in-depth one. Take pictures of things that you know are off in your body, hair, skin, nails, whatever it might be. Baseline your energy, your focus, your mood, neurological issues, how you sleep, all the things. If you have a specific issue going on, baseline where you are today with those things. And then after a week, come back to your tracker and do it again. I find 10-15% of people have noticed a shift in something in their tracker, which means 85-90% of you are going to go, nothing happened, right? Because it's working on the cellular level. So when we say keep going, at month 1, 30 days in, about 50%, I'd say half of you are going to go, oh, look, this shifted. And then continuing on month 2, month 3, we see by month 3, 90% of people have noticed a shift in their health tracker. All right, so that's just kind of expectations. Make sure you're well hydrated. This product, we do know that it does detox you. Your system will go through a detoxification, which some of you will notice and some of you won't. But if you get a headache or diarrhea or a rash or something like that, it just means you're responding really well and something's getting kicked out of the system. It's like the garbage in the cells are being taken out. And when that happens en masse, you can feel it. So just stay well hydrated. I'm in the US, so if you're in other countries, just kind of shift this into your measurements. But if you take your body weight in pounds, okay, let's say you're a 200-pound person, cut it in half, it's 100, drink that amount of ounces in water. Okay, that's what we kind of look at. So do that daily. So 100 ounces of water a day. Make sure your system is well hydrated. Again, that is just if you're 200 pounds. So if you're less than that, right, 150-pound person, you're drinking 75 ounces a day. So just look at that. And now let's talk about how much of this you should be drinking. And it comes in, the servings come with this little cup. ASEA gives this to us. And I want you, it's very faint, but 2 ounces is up here at the very top, okay? That is 2 ounces. And a serving size is gonna be anywhere between 4 to 8 ounces in a day, okay? So 2 to 4 cups of this. If you were in other countries, we're talking like, 120 mLs to 240 mLs. And this is how I kind of think about it. Think about a house, all right? If a house needs some construction work, right? And the contractors come to the job. The question is, well, how long is it going to take to do the project? And there's a couple of factors. Well, how much damage is in the house, right? What needs to be done? And how many contractors are coming on the job? If you need to repaint the house and you have one guy painting, it might take a couple days. If you have 10 guys painting, it's going to be done pretty fast, right? And so you need to think about, number one, what's your age? We know that as you get older, the mitochondria become less efficient, you have less redox being created in your own body. And so every decade of life, it's about 10% less. So a 30-year-old, maybe you're here, 40, 50, 60, right? You're at much less than you were when you were young. And so how do you replenish your supply? Well, if you're in your 30s, you might just need 4 ounces a day. If you're in your 60s, you might need 8 ounces a day, right? To replenish your supply. So age matters. All right, that's kind of the concept of, well, how many construction workers are already on the job site? Your age is going to indicate that. And then the next is like, how much damage is there? So how stressed is your body? How much are you pushing your body? Are you an athlete? Did you just go through surgery? Are you fighting something? Is your system really off balance because there is something that, you've gone to the doctor for and maybe you have a name for it? How much damage is in there? How out of balance are you? All right, that's going to be the other indicator, because the more out of balance, the more stress on the system, the more time you're going to need to come back to balance, and the more contractors would be helpful, right? The more redox signaling molecules would be helpful. So I always say, look, if you're young and healthy and fit, 4 ounces a day, pretty good. Just maintain yourself. If you are an athlete and you're really pushing your system and you're putting a lot of stress on your system, or you work out a lot, 8 ounces a day. It's probably going to be really good for you, right? Maybe take 2 ounces before workout, 2 ounces after, and you're going to find you're going to get more out of your workouts and you're going to repair faster after your workouts. That's what I do. I personally drink 8 ounces a day for these reasons. Now, if you're someone that has a severe issue going on, right? You're very out of balance. You're probably going to want 8 ounces, right? You're just going to want more workers on the job site to help your system figure out where's the damage, what needs to get turned back on, what's not functioning properly, get the bad cells out of there, get the good ones back in. This is what you're going to be looking at. So between 4 and 8 ounces, and what I want to say just very briefly, how to take it, make sure you split it up. So if you're doing 4 ounces a day, you'll do 1 of these in the morning, 2 ounces in the morning, 2 ounces at night. 8 ounces a day, you'll do 2 of these in the morning and 2 of these at night. All right, we say to split it up because we want to get redox kind of in the system throughout. So split it up morning, night, it's great to do. You want to take it on an empty stomach, and you're going to swish it before you swallow. So they just did a recent study and they found that swishing it for between 15 and 30 seconds seems to be the sweet spot. You'll hear maybe older videos say 60 seconds, but they did some research. They found 15 to 30 seconds really is where most is absorbed into the system. It gets absorbed sublingually, just right into your body. Like I said before, it's not digested. It doesn't go and pass through the liver, the kidneys, all of that. It just goes straight into your system. Your body, guys, makes this. So your body recognizes it as soon as you drink it. It's native to you. What's in this is literally in you. All right, that's why there's no toxicity. You can't be allergic, all the things we talked about before. So when you swish it, it just goes to work immediately in your system. And then you just need to wait about 5 minutes before you eat, drink, do anything else. All right, so that's going to set you up really well. I hope that this helps you to figure out, look, how much are you needing? If you have questions, put them in the comments. If you are just looking at ASEA and you're wanting to get started, I'd be happy to do a little consult call with you to discuss what would be best for you. Just reach out to me. My information will be in the description. You can send me a message on WhatsApp, and I look forward to seeing you on the other side. If you found value from this, of course, like the video, subscribe to the channel. I'll be sharing more and more about this incredible company and all of their products.